Well, throughout this month, we are highlighting stories of remarkable women here in Central Texas. Inspired by her own experience as a child growing up in the Rio Grande Valley, relying on food stamps and free healthcare clinics, we want to introduce you to Cecilia Corral. KXAN's Erica Brennis shares her story.
Growing up in the Rio Grande Valley, Cecilia Corral got an opportunity in high school that would change the course of her life.
I ended up graduating from high school with an associate's in engineering.
An early college STEM program would take her on a journey to California, where she'd earn a degree in engineering from Stanford, meet her husband, and then make her way back to Texas for grad school for mechanical engineering at UT Austin. But as life often does, it threw her a curveball.
Unfortunately, the first year I was in graduate school, my dad had prostate cancer, passed away, and that's what led me to reevaluate what I was doing. Having an impact in the world was something that my dad and I used to talk a lot about when I was at Stanford, because he felt like I had a responsibility in some way for the opportunity I had been given to give back in some meaningful way.
And Cecilia found the way that she would fulfill that goal. She and her husband created CareMessage, which enables free community healthcare clinics to text message their patients.
A lot of the patients that we serve are working class, everyday people that are working 2 or 3 jobs, and they don't have the time to get on the phone, when the clinic is open, to pick up a phone call and have a conversation about what kind of cancer screening am I going to pick. And I started this organization based on a lot of my personal lived experiences. I relied on Medicaid and food stamps for a lot of my childhood. And we received care at our local free clinic and community health center.
From their first client, a small free clinic in San Francisco that started using their technology 12 years ago, CareMessage is now used by nearly 500 organizations across the U.S.
My family grew up going to free clinics and community health centers in the Rio Grande Valley. It was a full circle moment the day one of those free clinics became a customer of CareMessage.
And one of those providers is Volunteer Healthcare Clinic in Austin.
CareMessage has been so helpful in being able to follow up with the patient, ask them if they received any additional requests from the medical access program. And if they did, then they can send me those images through text. And so that really eliminates them having to come back to the clinic, make that special trip. And for some of our patients, that's a big deal because they have issues with transportation.
The clinic has been serving low-income patients in Travis County since 1966. And 60 years later, the staff is now able to communicate with their patients using modern technology.
If I need to contact a patient because they called in for a refill request and there's no refills remaining, then we need to get them back into the office so they can see a doctor. Sometimes it's hard to reach them by phone, so sending a message is definitely way faster. I get a response sooner.
Recently, the CareMessage team has been utilizing advancements in communication using AI to improve how clinics communicate with each patient on a customized individual basis.
When we have great solutions in both primary care and with improved health education, addressing nutrition and exercise and a lot of these lifestyle factors, we could make a really big difference.
Erica Brennis, KXAN News.
Erica, thank you. CareMessage enables their healthcare clinic clients to reach about 6 million patients a year by text.